Hey everybody, it's Matt Shu from Upright Health, and today I'm going to be answering the question, do orthotics work? Are they good for you? And related to that question, what kind of shoes should you be wearing? Now, this comes up quite often with clients. This comes up quite often when somebody has foot pain or knee pain, hip pain or back pain. A lot of times people are told that they should use orthotics to in some way correct a dysfunction that is supposedly causing them hip, back, knee, whatever, ankle, foot pain. So I actually have a client here who she has had about 2 months worth of constant unremitting and really painful foot pain and then ankle pain. She was told that the problem was her shoes, so she got different shoes, and those shoes, actually, sorry, not just those shoes. She was told to get new shoes and some specific orthotics to help her with her foot and ankle pain. And those both together actually made things worse. And then she went to see a doctor who said, oh, well, you actually have peroneal tendonitis. And basically at that age, that means that you need to just stop walking for the next 3 to 4 months, which is in itself quite a crazy thing to tell somebody who has to actually do a job. But in any case, the orthotics and the shoe definitely didn't really help. Now, that doesn't mean they don't ever help. So I've personally used orthotics. I have personally experimented with different orthotics. Back when my feet, ankles, knees, hips, and back used to hurt a lot, I would definitely use them. And so the answer is, do they work? And the answer is yes. They actually affect the way your body moves, and they affect the way muscles work throughout your body. So in that sense, orthotics definitely work. Are they effective at actually helping you feel better? Sometimes. In this client's case, not really, clearly not really. In other people's cases, sometimes it can help. So an example from my own past was I used to wake up every morning with my calves and feet just burning. They would ache and burn. As soon as I became conscious, I would have about 2-3 moments of peace, and then I would feel my calves and feet just go and just cramp up like crazy. And then walking outside, walking on the sidewalk, I would feel my feet burn and just almost sting and just be painful all through the bottoms of my feet. Not really fun, not really comfortable. So what I tried to do was pad my feet as much as possible. So I got thicker shoes, I got orthotics to see if that would help. And that basically would numb the discomfort, but it's not like the pain would go away. So if I took those things out and started walking, I would still feel discomfort. It just made it so it wasn't quite as sharp. Sometimes though, people notice when they put orthotics in, they feel a little bit better, or things have changed, and that's definitely possible. Just imagine what would happen if we weren't thinking about this in terms of human beings, but if we had like a pet monkey and we strapped some thick boards to the bottoms of their feet, would it affect the way that monkey walks? Yes, it absolutely would. If you think about this with your pet dog, if you put like little pieces of metal that were square shaped right under the pad of your dog's paw, would it affect the way your dog walks and moves? Absolutely. Would that have some effect on comfort levels in either a positive or negative way on your pet? You would absolutely have an effect. So when you put orthotics on, yeah, it's going to do something to you. Whether or not that ends up making you feel better or worse is sort of anybody's guess from what I can tell. And so in relationship to that, you need to think about whether or not that's a solid long-term solution. When you think about what's going on, like if we put an orthotic on your dog or cat, does it seem to make sense, right? You have an animal that has muscles, that has soft tissue that's supposed to do things in a certain way. It would seem kind of silly to throw some stiff, rigid object under their foot and expect them to function well. So how is that different than sticking a rigid thing on your foot and expecting your body to function well? So what I encourage most of my clients to do is try to get into shoes that allow their feet to function well. That doesn't mean they have to have super minimalist barefoot shoes with the ugly toes, the five-finger shoes. I have owned a pair. I no longer own a pair, but I have owned a pair. I did wear them. I found them very comfortable, very fun to walk around in, but you don't have to have those types of shoes if you don't feel like you want to, because they're really weird looking. But getting shoes that are comfortable and flexible and that allow your feet to do what they should be able to naturally do. So you've probably seen in some videos, I have some pretty flexible shoes. I have very thin shoes. I can bend them, I can fold them up, practically stick them in my pocket. They're pretty mobile. I have some that are, the sole is like this thick, like tiny thickness. And then I have some that are a bit thicker. So like if I go hiking or trail running, I still have pretty good function of my feet, but I also have padding so that I'm not feeling every single rock. Unless I want to feel every single rock, in which case I'll wear my thinner soled shoes. So there's always a lot of talk about getting a shoe that's more supportive, getting an orthotic that's going to support your foot. But again, go back to the idea of whether or not that makes sense. If you're just looking at any other animal in nature that needs to move around, does it help that animal move better if you stick something stiff and heavily padded, and then even more stiff, oftentimes more stiff in that padding? Sticking something stiff under the foot of one of these animals, does that make sense? Does that make that animal healthier and move better and help it use its muscles better? I would suggest that it absolutely does not help other animals, and for human beings, rather than use stiff, rigid objects under our feet to try to make our knees, hips, ankles, feet, and backs feel better, we should probably figure out what in the chain, in the whole body, is going wrong and what needs to be retrained to make things work better and feel better. With arches being high or low, flat foot, high arched, whatever, pronating, supinating, those are all things that involve the whole leg and the hip joint, and possibly even the pelvis and the spine. So rather than narrow in on just saying, well, your arch is flat, you also need to look at how things above are functioning to see whether or not there's a way you can support that better using musculature, rather than just focusing in on sticking a crutch underneath that little piece of architecture that you want to adjust. Your body's positioning is best adjusted by dealing with the muscles whose job it is to maintain positions and to change positions. So in short, orthotics do have an effect. I don't think it's a particularly great effect, but it can sometimes make things feel at least temporarily better. As far as shoes go, make sure you're getting something that allows your feet to function well, and adjust the amount of padding based on your actual needs and comfort levels, so that you don't have to suffer through 14-hour days on a tiny little thin-soled shoe, or if you're running barefoot out in the woods, then do whatever you want to do. All right, guys, that's it for today's video. Remember to subscribe, and remember that pain sucks, life shouldn't. If you liked the video, don't forget to like, share, and comment, and don't forget to subscribe.